Hi, good afternoon. Welcome to the webinar on the call for proposals for community voices for health, and thanks so much for joining us. I'm Susan Mende. I'm a Senior Program Officer at Robert Wood Johnson Foundation. I'd just like to take a moment to explain to you why Robert Wood Johnson Foundation is so excited about this work and this new initiative. For the past 40 years, we have been working to improve health and healthcare for all Americans and to build a culture of health that provides everyone a fair and just opportunity for health and well-being, no matter who they are or where they live. So this means that the systems and policies that serve and affect communities need to be centered around what people in those communities want and what they feel that they need. Clearly, we cannot hope to achieve that end if we don't amplify the voices of communities, particularly those that have way too often been left behind or ignored. And that's why we're really excited about this work, Community Voices for Health, that we are going to be discussing today. We have two key partners with whom we're working on this initiative, and you will hear from both of them. They're Public Agenda and Altarum. And this next slide provides you a bit more information on their organizations. Public Agenda will be leading this initiative, and both they and Altarum will be working closely with and providing a range of technical assistance to the successful grantees. So Matt Leighninger, the Vice President of Public Agenda, is going to kick off this webinar and walk you through our time together today. Thank you.
Thank you, Susan. So, hi, I'm Matt Leighninger. The organization I work for, Public Agenda, is a nonprofit, nonpartisan organization based in New York City. We were founded in 1975, and we work to strengthen democracy and expand opportunity by fostering thoughtful public opinion, meaningful public engagement, and responsive public institutions. A couple of my colleagues who work with me, we work together on the engagement side of that pretty large challenge. My colleagues are Nicole Cabral and Jennifer Oriana. You may have already emailed with them, and they'll be working on this project with us. Lynn, do you want to say a little bit about Altarum?
Yes, I'd be happy to. This is Lynn Quincy. I'm the director of the Healthcare Value Hub at Altarum. Altarum is a nonprofit research and consulting organization that creates and implements solutions to advance health among the vulnerable and publicly insured populations. Altarum is headquartered in Ann Arbor, Michigan, but we also have offices in D.C., Portland, Maine, and Chicago. And our roots in public sector innovation go all the way back to 1946. In addition to hearing from me, I am working with two Altarum staff members. Amanda Hunt and Sababa Hatnagar are also supporting this project, and you'll hear a lot more about that technical assistance shortly. Back to you, Matt.
Awesome, thank you. And so the next slide is our agenda, what we're trying to cover in the next hour or so. We want to give you the overview with kind of the broad goal here, some of the components of the project. We want to talk about what kinds of organizations are eligible. We'll give you the overall timeline. We want to say a little bit about what we're looking for in the proposals that will make them compelling and appropriate for this CFP. We'll give you a rundown of the technical assistance that Public Agenda and Altarum can provide to projects that get funded through this CFP. And of course, we want to answer questions. So the logistics of that are, you see that Q&A button at the bottom of your screen, a little to the left. If you just click on that, it will enable you to type in a question. You can do that now or whenever you want to. You'll also be able to see questions that other people asked. We also have been receiving questions by email over the last week or so, and so we've already been responding to some of those. We picked out a few that are particularly we thought were particularly important or complicated, and we're going to tackle those questions first in the Q&A at the end of the slides here. So we'll take on a few of those ones that we got emailed, and then we'll turn to some of the ones that we are receiving during the course of the webinar. We probably won't be able to get to them all. There's 354 and counting people on this call right now, but we'll do our best. Rest assured, this will not be your last opportunity to ask questions. You can continue emailing us. You can call us afterward. And also, all of the answers that we give, both on the webinar and in the emails, all of that's being compiled and added to the FAQs, which you can see if you go to the rwjf.org CFP site, also communityvoicesforhealth.org. So that all the answers will be there and available. And also, we're recording this webinar, so you'll be able to, in a day or so, you'll be able to access the recording of this webinar at both the rwjf.org site and also the communityvoicesforhealth.org. Both those URLs are plastered over all of the emails and other materials that you've seen from us. So the overarching goal of this project is to build stronger engagement infrastructure. And we can go to that next slide here. And basically what we see when we see kind of the engagement kind of landscape in most states and most communities, we see lots of great building blocks, but often not lots of connections between them. We see lots of very inspiring examples, standalone projects, temporary initiatives, and some of them are very powerful. But even in the best cases, when I am looking at that kind of landscape, I'm often seeing kind of a lack of connections, a lack of infrastructure to support engagement overall. So we think that by helping states and communities kind of build a stronger infrastructure, we can improve engagement in several ways. And I'll get to those in a second. But first, let me go to the next slide, the one with the graphic on it. And you can see kind of a picture here. And part of the picture, what we're trying to acknowledge here is that we're not starting from scratch, that there are engagement opportunities. There are building blocks that exist in almost every community in every state. And one of the first things we want to do is kind of figure out what's already out there and what you can build on, what you can support, what you can connect. And then we realize also this is a long-term challenge. These are 30-month projects, 30 months worth of funding for the CFP. And we anticipate that by the end of the 30 months, you'll be able to kind of build up from those initial building blocks, found others, created others, connected them better, and connected people and their institutions, there's the buildings there, in better ways so that you're building up to bigger changes. And we hope, if you look at the next slide, we hope that this will make engagement better in several ways. First, it will make engagement more inclusive by expanding the number of people involved overall, but also, in particular, involving people from previously marginalized communities and populations, people who have been underserved in the past, whose voices have not been heard in policy questions or other kinds of decisions that affect health and affect their lives. So we hope that engagement infrastructure, if it is stronger, we can reach this much broader array of people. We hope that it can be sustained better, and we'll talk a little bit more later on what we mean by that. We also hope that engagement will be more informed, and Lynn's going to talk about some ways in which community-engaged research can contribute to making engagement more informed and knowledgeable. And then finally, we think that by having much larger numbers of people involved in a broader array of people involved in more sustained ways, that engagement can be more influential and influence the decisions being made by policymakers and other decision makers. Lynn, I think you're going to talk about the grants next.
All right, I'm happy to do that. Next slide, please. So let's get some basics out of the way. Under this project, Community Voices for Health, we'll be awarding 6 grants, no more than 1 per state. Only a subset of states is eligible to apply. I won't read the list. I'm sure you've got it in front of you, and we have a map coming up soon. Up to $660,000 per project is available, and that's for work spanning up to 30 months. So a nice long time to create an impact. And as has already been mentioned, and we'll be spending some time talking about today, grantees will have available to them some significant technical assistance from Public Agenda and Altarum. Next slide, please. So here is a key piece of information that we have gotten a lot of questions about. Due to the nature of what we're trying to accomplish, the lead organization, the entity that is applying for these funds, submitting a proposal, has to be a public charity, as in a nonprofit 501c3, but in addition, they have to be a community-based organization located in that state or a statewide network of such organizations. So examples of these types of entities might be a consumer advocacy network, an organization serving recent immigrants, affordable housing advocate, or a civic engagement organization. And those are just examples. Now, these lead organizations, however, are encouraged to partner with other types of stakeholders as seems appropriate in their state in order to get things done. These other types of stakeholders might be public agencies, healthcare systems, public health departments, university-based centers, membership associations, social services providers, and many others. It is completely up to the grantee as to what types of partnerships make the most sense. I am going to single out one type of partner, though, researchers. As Matt and Susan have already explained, community-engaged research is a core component of this project. So we're not only encouraging, but we are expecting in these proposals that some plan for how that research is going to happen will be included. And we have a slide coming up that dives a little bit more deeply into what we mean by that. The next slide, please. This is a map of that same list of organizations, and it may seem like we just drew a line along the bottom of the map, but in reality, we actually had we're looking for a diversity of states in order to maximize our learnings from this project, and I think Susan's going to talk a little bit about this at the end. And we selected states that had the diversity that we were looking for. The next slide, please. So the timeline. We hope to hear from as many of you as possible by October 7th, and we will review those proposals along with a team of reviewers and get back to our applicants by early December for a rapid start in January 15 of 2020. Then begins the 30-month work period. We're going to be, all of them will be wrapped up by June 30th, 2022. And at that point, we hope to have some very robust learnings to share with everyone. Next slide, please. So what needs to be in this proposal? I'm sure this is the key question. First of all, we strongly encourage you, I'm sure you already have, but to refer to the CFP, which has all the great information. But I will go over just a couple of the core components, trying to amplify a little bit. So a key component of the proposal is a plan, and a plan that reflects back the slide that Matt just had up about how we're going to strengthen infrastructure to make it more inclusive and sustained, more informed through community-engaged research, and it has to be influential. That's a part of the big idea, and by building even stronger pathways between community members and policymakers. So that sound plan has to be included. It's going to describe your partnerships with, and that is going to be up to you, and it can include all those organizations that I mentioned previously. There is a strong emphasis in this call for proposal on previously underserved or marginalized communities. It doesn't have to be every marginalized community, but we hope to see in your proposal a history of working with some sort of marginalized or underserved community, a commitment to inclusion and health equity, and the capacity to engage an underserved population that you've chosen to emphasize. An example of that would be a proven ability to work in non-English languages, or perhaps a network or an infrastructure that extends into rural areas. It all depends on what is the community that you're going to be working with. But we would like to see all of those things incorporated into your proposal. We're looking for a plan with respect to community-engaged research, as you'll hear a little bit more about in a moment. This is the idea that knowledge is power, and shared knowledge is even more powerful. And by creating knowledge about the community that we're trying to serve through a partnership with researchers that heavily involves the community members, we think that this engagement infrastructure will be greatly strengthened. And again, we'll talk more about that in a little bit. Policymaking connections. It's an important part of this engagement that we are influencing policy. So we want to hear about your plans for fostering those connections. And finally, if you can bring other resources to the table, in-kind assistance, or anything else that's going to help make your project successful, we want to hear about that. We're very interested in creative proposals. And next slide, please. And the scale of this can take a couple approaches. We definitely welcome statewide approaches. We think that's going to be fairly powerful in terms of the policymaking aspect of this project. But if you want to start local, or if that's where your creative idea lies, that's also acceptable. But we do want to hear in your proposal, how are you going to scale that up? What is the potential for the local idea to be scaled? Similarly, if you want to start with a single issue, if your creative idea evolves around a single health issue, we still want to hear from you, but we would like to know if you have ideas about how to go from that issue to a broader engagement approach. We would welcome that information. Next slide, please. We have resources available to help everyone. There are two websites you're going to, and they're hyperlinked to each other. One is the Robert Wood Johnson Foundation website, and the other one is one set up specifically for this project, communityvoicesforhealth.org. Some things that you will already find there is a guide that lays out the options for building stronger engagement infrastructure, including strategies for engaging marginalized communities. Quite a few resources around this idea of community engaged research, some guidance on what best practices look like, examples of this type of research being done around the country. An example of an engagement scan that was done in Pennsylvania during our planning process. This is a type of technical assistance that's going to be available after the project starts, so if you want to get a sense of what that looks like, we hope you'll have a look. And similarly, some policy explainers that were developed for Pennsylvania during the planning process. That's another example of some technical assistance that will be available after project start, and you may want to get a sense of what it looks like. Next slide, please. Matt, I think it's over to you.
It is. Thank you, Lynn. And so this slide is a repeat of one that we showed you before, the kind of 3 ways in which we think engagement might improve with a stronger infrastructure. And I just want to use this to show you, yes, these are wonderful words, but they're all rather abstract. And we thought you might want a much more kind of concrete, tangible example of what this could look like if you were to do this and try to implement these things in your state or your community. So what we did was kind of create a hypothetical for you, and that's featured on the next slide. And what we created was a kind of a tangible, a much more concrete example, and it's actually in much greater detail. It's on page 2 of the CFP. You'll see it there in a box. But we created this hypothetical out of real live examples and pictures, actually, of real live engagement opportunities that we know about. So we wanted to give you something that kind of illustrates what you might do, but also is grounded in real life. And basically, the kind of hypothetical we're giving you is that you, as a lead organization in your state, that you started out by working with your partners and deciding that mental health is the kind of subset of health that you wanted to work on. You don't have to work on a subset, as Lynn just said, but you decided in this hypothetical scenario that you wanted to work on mental health. And then you started by trying to kind of assess and take stock of all the ways in which people around your state are engaging in mental health issues, and you found all kinds of things, some of which you knew about, some of which were new to you. Public Agenda helped you do this by doing an engagement scan like the one Lynn just mentioned. So you found people for self-help reasons, or trying to find information about the issue, or in ways that were trying to kind of influence decisions. All these different kinds of ways people were engaging in mental health, and you tried to connect and support and link with many of those. You also realized that engagement wasn't reaching all the people you wanted to engage, and in your case, you wanted to reach more people in rural areas. So you started some new types of engagement opportunities called Meet and Eat, and this is a model that's already happening in West Virginia, has been for several years, where people get together regularly to talk at a lunch, at a meal-based sort of engagement where they're talking about issues in their town and things that they want to do about it. Then you wanted to have a strategy to link all these different kinds of engagement opportunities that you found or created, and you started using something called Text, Talk, and Act, which is basically it's a process where you're using smartphones to connect lots and lots of face-to-face opportunities. It was something that was developed through the National Dialogue on Mental Health a couple of years ago, and basically through the smartphones you can have people who are face-to-face in groups of 2 or 3, and what it does is through their phones they get discussion questions, information about the issue and policy options, and they can also answer and give their preferences on some of the policy questions and other things that they want to see. So it's a way of kind of reaching people in lots of different places in kind of all on the same day and kind of aggregating all of their input. The way you did this also was to kind of use community-based research kinds of community-engaged research, like the kinds that Lynn has been talking about, to come up with knowledge and evidence people would need about mental health and mental health policy options and different kinds of opportunities. You then presented all of those recommendations you were receiving through all these different kinds of engagement opportunities through Text, Talk, and Act to policymakers in your state. And you established more of a give and take with them, where they could in fact then go back and ask further questions of the public, of people in the state about different kinds of policy questions and things that they wanted to know. So by setting up kind of a much larger infrastructure of people who are meeting regularly, including people who hadn't been heard from before, and having that happen in a much more kind of give and take sort of way with public officials and other kinds of decision makers, you were able to have influence on some key policy questions relating to mental health. Also, by the end of the 30 months of your project, you were able to kind of, by giving people chances to work on local and neighborhood level kinds of ideas, grew the project more, grew the infrastructure more, so they had more opportunities for people to engage, and eventually you also moved on to other health-related issues in addition to mental health. So you can read kind of the longer version of that in the CFP or ask us more questions about it, but that was just one vision of how these kind of very high, kind of abstract, powerful ideas could in fact be implemented in a real-life situation. Lynn, I think you're going to talk about an example for research as well.
Yes. Next slide, please. So first, in case you haven't encountered the term before, community-engaged research is a very specific process that is highly collaborative between researchers and community members with very equal power sharing, if you will. And we have some extensive information about this on the website. Sometimes it's also known as community-based participatory research, but the big idea is that both entities are full partners in the research, and that the goal of the research is to contribute to the well-being of the community. And this component is being emphasized in this project because we think that by including this component, it will increase our understanding of the community's experiences with the health system. It will raise the profile of the community's efforts, and it will support evidence-based policymaking. Next slide, please. Here is just a quick example. It's actually an amalgamation of some of our favorite projects that we researched in the planning phase for this project. So a local community, as an example, might engage high school students to conduct surveys around the community in an effort to surface what their needs are. Similarly, or in addition, we might arm community members to do walk audits. Maybe we're arming them with video cameras or GIS systems to further document what are the needs in the local community. This information is presented at local community meetings to understand its implications. You might then produce a high-impact multimedia report with all this information that was gathered by community members. And in the examples that we have surfaced, it can profoundly impact policymaking because it's new evidence that they haven't seen before, and it's typically considered to be very persuasive. With that, I'm going to turn it over to you, Matt, for the final discussion, the final leg, policymakers.
It's like a relay race. So next slide is about policymaking and the kind of the ways in which we think you could help community members and decision makers work together better through this kind of project. And one way is that simply by kind of changing the nature of the engagement itself, improving it in some of the ways that we already listed, that you have more people involved, more diverse voices, those people are connected to one another better, the input is aggregated, that you're creating kind of more of a critical mass that's both easier for policymakers to deal with and also has more influence on them because you simply have more people involved, they know where people are involved, and that has some influence in itself. Second, that you're creating kind of more of a back and forth, so that you're giving people opportunities to say, oh, I would like to know from the public what they think about this. And also this is true for researchers as well, so they can kind of propose different options they want input on, or different issues that they want to get people's thoughts on. And then finally, we, Public Agenda at Altarum, can be helpful in this arena by working with you on this. We can be doing policy breakfasts and other kinds of events that help public officials and other decision makers, understand better what you're doing. We can be hosting and helping you put on deliberative forums, other kinds of events that help them interact with some of the people you're engaging, and so on. So if we go to the next slide. This is kind of a summary here of the different ways that Public Agenda and Altarum can help you according to the different things that you're trying to do. So in terms of making engagement more inclusive and sustained, as we've said, one thing that Public Agenda can do off the bat is to create an engagement scan like the one we did for Pennsylvania of your community or your state. And then we can also provide other resources and other TA in person, on the phone, and all that on different kinds of engagement strategies, recruitment strategies, ways to do online engagement as well as face-to-face, and ways to blend them, all those sorts of things. Lynn and her team at Altarum can obviously be helpful in the way she described in terms of giving resources and TA on community-engaged research and helping you do that part of this. And then both groups can be helpful in terms of some of the work with policymakers that I just described. So this next slide is kind of the last content slide, and we just wanted to return to the idea of why engagement matters. I mean, we think essentially that engagement matters at three levels. First of all, we know from all kinds of research that our physical health depends on how well people are connected to one another. It depends on our social networks and the level of social capital in our neighborhoods and our communities. And so that engagement, just at the most basic level, how people are talking with and connected with their neighbors, their colleagues, their friends, that is in fact something that is influential as far as our physical health. We also think it matters, engagement matters at the level of the community, because when you have more good opportunities for people to kind of name problems and opportunities and work together to address them, that community health also improves. And then finally, we feel that by, and this is the more kind of the futuristic part of this, by doing this kind of work at the scale of the state, by having a better infrastructure for it, a larger, more connected set of engagement opportunities across the state, that people can have a much stronger, more informed voice in health policy decisions, and that will have impacts on our healthcare systems, our social service systems, our public health systems, make them all more able to benefit the people they are intended to serve. So that's the last of the content slides, and the next one is queued up for the questions. And so I'll remind you that we're going to start with some of the questions we received by email that we thought were particularly notable, and we will go into after we deal with those, talk about those a bit, we will go to the queue, the ones we're receiving, and there's already, I can see 22 in the queue during the webinar today, and try to talk about as many of those as we can. But just to remind you, the recording of the webinar will be available at both of those sites, and also all of the questions and all of the answers will be documented on the FAQs, and that also will be available to you at that link. So, turning to the questions we've received from the email, Susan, I think we've heard from a number of people about kind of the short timeline here, and we know that's difficult for people, but I thought you had a little bit more you want to say about that question. Susan.
You might be muted, Susan.
Yes, it looks like she's muted.
Oh, sorry. Okay.
Oh,
so thank you. So I just wanted to also reiterate that, yes, the webinar is being recorded. That will also be available on the website, as will the slides be available. So just wanted to let you know that. So about the timeline by which you can send the proposal. We want to get moving on this work. And of course, we have a big timeline for the entire initiative, and we really wanted people to have as much time as possible to actually do the work. Once the grantees are selected, we felt that was really where the time should be where people really needed as much time. We know that this is tough work, and so we wanted to give people the time that they need to do it in partnership.
Yeah, great. Okay. And looking at these other ones we want to tackle right away, Lynn, you're going to talk next, I think, about the one about more than one state being part of a proposal. I've got one about people finding other kind of potential partners. Then Susan, maybe we'll go back to you about kind of subsequent funding opportunities, and then we'll end with the one about universities. So Lynn, can you go ahead with the one about the multi-state proposals?
Yes. So we've gotten a couple questions from entities that work across state lines, and they wanted to know if they could propose an idea that had a regional approach and it crossed the boundaries of two states. And the answer is, this is acceptable as long as both states are on the list of qualifying states, and the lead organization, and we meet our other criteria. The lead organization is a community-based organization, presumably already working on this regional basis. That would result in a single grant being awarded to this region that happens to have parts of two states in it. And the proposer would need to be very clear with respect to their plan for improving communications with policymakers, given they're now talking about two states' policymaking environments and not one. Matt?
So we also have had some questions from people who are trying to find other applicants that they might partner with, and trying to find other people in their state or in their area. And of course, we're torn about this because we want people to find one another, and part of the idea of this whole project is to help people who are organizations that are working in research, find engagement organizations, or organizations working with different populations. But at the same time, we're a bit limited because, of course, your applications are confidential. We can't tell people who is actually applying or beginning to kind of fill out an application on the RWJF website. So we are willing to do this, or are able to do this. We can put kind of an online bulletin board, and that would be something that we would link to. It'll be a Google Doc we would link to through the communityvoicesforhealth.org website. And basically it would be a very simple thing. We would just basically put up a list with the different states listed and a kind of a column for organizations, and what you would be able to do is say, yes, I'm here in Alabama or in Indiana or whatever, and I'm interested in finding other partners. So it would be kind of a space that we would provide, a bulletin board type space, but it would be up to you all. It would be up to organizations to actually self-identify and say, yes, I'm interested in working with other groups. If you're interested in something like that, please tell us. Please use the Q&A right now. You can say, yes, we'd like a bulletin board, or you can email us afterward. If we have a bunch of requests, people who seem to like that, we'll go ahead and do it. If nobody wants it, then we won't. But we wanted to at least give that, offer that as a possibility for people who are trying to find other organizations they might want to work with in their states. Susan, there was questions, a number of people have asked about kind of subsequent funding opportunities, or whether it be a second round in this one, and I think you wanted to say something about that.
Okay, yeah, thanks. No, we are not planning a second round. We really want to get this one going, and we want to see what we uncover and what we learn, and we hope that that informs all of our work going forward, but there is no second round planned.
Okay. So one more, I think that this, and I know you touched on this briefly, Lynn, but there have been a whole bunch of questions about university-based organizations, whether they would be eligible as lead applicants for these grants. And the answer is that, if you look at the CFP, so first of all, the applicant lead organization, this is page 3, I'm reading from the CFP. The applicant or lead organization must be recognized as a public charity under Section 501c3 nonprofit status. So there, obviously, that has to be satisfied. Also, it says the lead organization should be a community-based organization or network of community-based organizations, such as a consumer advocacy network, an organization serving recent immigrants, an affordable housing advocate, or a civic engagement organization. So we know that there are organizations like those that are based at universities. So if your organization is a 501c3 and you are connected to a university and you also fit one of these other types of organizations, then you certainly could be a lead applicant. But just be careful and look at that list that we have in the CFP, and certainly email us questions if they're still unclear. Lynn and Susan, we do have, we're continuing to get kind of questions about the state list, and I think maybe it's worth repeating there also what we say, in the CFP in terms of how we kind of came up with this list of 20 states, and basically, we were trying to kind of maximize learning from the project. And we know all kinds of states face challenges with respect to engagement and increasing it, but we wanted to maximize our learnings, and we took into consideration a number of factors designed to capture the diversity of the kind of the situations in different states. And so the factors were included, but weren't limited to geography, demographics, and policy climate. So we apologize if your state is not on the list, but it was a difficult decision we had to make. But that's how we ended up at the list of 20 you see here.
And Matt, one of the questions was the beginning slides weren't viewable. Can you show the eligible organizations and states again? So maybe we could just back up and put the map back up.
Map, sure, okay, good idea. So now, Lynn and Susan, I know. First of all, let me apologize to the whole group. We wish we could actually have you give your questions verbally, but with 376 people on the phone, we'd run out of time very quickly. So we're just trying to do it this way by looking at what you're taping in, and kind of trying to talk about the questions that way. And I've been looking at the list, and Susan and Lynn, I know you have as well. One I see that jumped out at me. Someone asked, do potential partnerships need to be firm and established? That's a somewhat complicated one, because I think we do anticipate that you have a much more compelling application if you have at least some of your partnerships in place and firmed up, and that hopefully these are groups that you've worked with in the past, and you can talk about some of the things that you may have already accomplished together along the lines of what we're talking about in the CFP. But we also realize that you're going to want to probably be expanding that list of partners even, in the process of doing the proposal, and also even after being awarded the grant. If you're trying to do engagement, or you're trying to reach organizations and populations you haven't before, and so that means kind of inviting people, leaders of those groups, to be a part of your decision-making group and part of your partnership. And so we think this is something that you probably should think of as a growing partnership. But I think that in the initial for the initial proposal, yes, you would need at least some of that, some partners firmed up who can be helpful in accomplishing some of the things that you talk about in your application.
And maybe piggybacking off of that, there's several questions about whether or not a health system, if they're a nonprofit, could they be the lead, or a primary care association, could they be the lead? And I think the answer is generally going to be you can't be the lead because you don't meet our community-based organization definition. But you should, if you're interested in accomplishing these goals, maybe you could find a community-based organization in your state to partner with.
So Susan and both, please do chime in with other ones you want to answer. I see one here that says, we are a national organization with a presence in 6 states. The majority of locations are in the listed geographic locations.
Matt, you're cutting out from time to time. Like we can't hear you right now.
Well,
oh, now you're back. Now you're back.
Okay. Sorry. We are a national organization with presence in 6 states. I'm reading the question. We are a national organization with presence in 6 states. The majority of locations are in the listed geographic locations, and some are not. Do you recommend applying as a national organization and only include key states listed in your priority states, or include all locations? And Susan and Lynn, please do weigh on this. I think we would not want anyone to apply as a national organization. I think what we'd want is someone applying as a kind of maybe a multi-state collaboration, like you talked about earlier, Lynn, or one state that is promising to work with a second, or something like that. But a national organization trying to do this in 6 states at once seems like it's kind of falling outside the scope of this CFP.
Yes, and then to further clarify, if it is multi-state, I think it would be because it's a geographically cohesive region. It wouldn't be two completely disparate states.
Right.
This is Susan. I can answer one asking about lobbying guidelines. Those are, we can post the answer to that on the website. We have some very clear guidelines around that apply to all funding from Robert Wood Johnson Foundation.
Another question I saw is asking for clarity on whether or not a community research component is a required element. And a research partner is a required element. We want that to become part of the infrastructure that will hopefully endure and make it much stronger. But exactly how you approach the research component is, I think we're open to a wide range of approaches. One question was, can you explain the technical assistance and what is offered? And I think that maybe some additional color there, and we could also put that slide back up if the public agenda folks want to go to the assistance slide. But I think that we have a very deep and wide range of technical assistance, and we would tailor that to what the grantee needed. It wouldn't be that they would be required to use every element we have available to them, but if they have a lot of power and creativity in two of those three primary project components, but they really need some technical assistance in the third leg, that's what we're there to do. We are there to make grantees as successful as possible. Yeah, that's very helpful. And I think something that is maybe on this list that's not quite as clear is we also will have policy expertise technical assistance available to the grantees, in addition to everything else on this list.
Another question is a broader question. Is how successful have other communities been with truly engaging policymakers? So essentially, in what ways have engagement efforts and as you might imagine, the answers are all over the map. Sometimes engagement efforts are very successful at affecting policy. Sometimes they're not at all. So looking at kind of all these different what is that critical mass numbers?
Matt, sorry, you're still fading in and out.
Sorry, let me try a different way of calling in. Why don't you go ahead with a different question?
Okay.
Yeah, I can try to answer that one. I think the question is sort of proof of concept. Is this a good idea? And I will say an unequivocal, it is a good idea. I think that we know that the ability for community voices to affect policy making in an evidence-based way really varies from location to location. But we know that it can work, we know that it can be strengthened, and this important project is designed to provide further information. Susan, did you want to add anything? Okay, I'm going to go on to another.
I think that's a very good answer. And again, I mean, we could spend many webinars on that question, and actually I'm sure that many people on the phone would have answers to that as well. But yes, we have seen success in these areas, and as you said, it's quite varied depending on the context and the state. But yes, we are building on knowledge that has already been developed.
And this might be a good time to reiterate, we're going to make an extensive effort to communicate the learnings from this project to as broad a community as possible. So hopefully we'll even have more to say in 30 months. Another question that we can answer is, will pre-existing programs or initiatives be considered for funding or only new potential projects? And I think the answer is yes. Pre-existing programs and initiatives can definitely be considered for funding. We would expect that your proposal would include some new things that you want to try or an amplification of what you're doing now that is well aligned with this project. But as Matt said at the beginning, there are many, engagement is happening everywhere. And one idea of this project is to take what's already happening, strengthen it, connect it, add these other layers onto it.
Great. And this is Susan. A simple one just to reiterate, people were asking how much and for how long. So it's up to $660,000 per successful applicant, and the project will be 30 months in length. And I just want to reiterate, sometimes we get very specific questions about this kind of organization or that kind of organization. I really encourage you to very, very clearly look at the call for proposals. We tried to be as explicit as possible in there. So I would first say really read those eligibility criteria very carefully, because hopefully you may be able to find some of the answers there.
This is Matt. Can you hope my audio is better now? And I'm seeing on the Q&A lots of people saying the bulletin board is a good idea and they would take advantage of that. So we'll probably do that.
Excellent. Another question, my eyes just lit upon it. Does this grant allow for some planning time before implementation? And I would say yes. We want to hear in the proposal a feasible, well thought out idea, but we would expect that there would be planning, making use of the technical assistance available to you before the actual implementation begins.
This is Susan. Sometimes we get questions about, I have had grant funding previously from Robert Wood Johnson Foundation, or my organization is currently receiving a grant from Robert Wood Johnson Foundation. Are we still eligible to apply? And the answer is yes. It's not one or the other.
And I'll take this one. Does the work need to be in furtherance of statewide policy, or can it be both local and statewide? It does have to be in the health policy space, but it can be local and statewide. That's completely acceptable. If your emphasis is local to start, we do want to hear if there's a plan or a pathway to making that stronger local engagement statewide.
And can I just also chime in on that one and correct me if you disagree, Lynn and Susan, but I think in terms of health, I think, we have a fairly broad kind of understanding of health in the CFP. There's all kinds of areas, housing and safety, gun violence, opioids, all kinds of things. So a number of them have been suggested already on the Q&A thread here. And so I think all of those issue areas, and probably some others, are certainly important and could be potential focus areas for an application. And then also, I think in terms of just to say a little more about the scalability thing, we do hope that these examples of engagement infrastructure that you would create, they would be scalable, either because from the outset they are statewide, and you're building the statewide system, or it's something that is actually starting in a community, but it's clear that it can be replicable and expanded to other communities within that state.
This is Susan. We've gotten some questions around scoring criteria. We do have in the call for proposals a section with eligibility criteria that we've already discussed, as well as selection criteria. And those selection criteria you can interpret as these are the areas for which we are particularly looking. Of course, we're looking for everything else that we ask you to include in the proposal, but those are the areas for which we are particularly looking. And I think that's the answer to the scoring criteria. We will have external reviewers reviewing these proposals, and so they will all be reviewed very carefully, and we will stick to the guidelines that we have shared with all of you in the call for proposals.
here's a good one, which is kind of complicated. The question is, well, I'm going to take one part of it. Is the expectation that this work should lead to a formal adoption of new approaches to engagement by public bodies, or might a grassroots-led engagement infrastructure that meaningfully informs public bodies and public policy be considered a successful outcome? So in other words, is the idea to kind of improve the way that decision makers, government agencies, public bodies, the way that they do engagement in order to reach the community, or is the idea that we would help the community kind of do engagement better in order to reach policymakers? And the answer is, I think, either one is fair game. I think we would be excited about proposals on both sides of that. But the most important thing is the in-between, the kind of how is it connecting those two sets of people in ways that actually serve both and to lead to policies that really represent what a wide variety of people want.
I'll try another one. Do all project partners have to be from the same state? I think the community-based lead organization must be firmly rooted in the state, and the research partner or partner should be firmly rooted in the state. The idea there is that they will be able to continue to make consumer engagement work better in the state even after the project ends. But Susan and Matt, correct me if I'm wrong, I think minor partners who have some sort of special expertise that are maybe coming from out of state, that might be acceptable.
Mm-hmm. Yeah, but yeah, certainly not the lead organization, but yeah, some of the minor partners.
Yes, agree.
And I think one variation of this, maybe you already kind of tackled this, but part of this is to have both engagement and research capacity supported and built in the state. So, for example, if you were having an engagement, the lead organization was doing engagement in the state, but they were using working with a research partner that was out of state, that would not be in kind of keeping with the whole thrust of this CFP. Does that sound right to you, Lynn and Susan?
Right. I'm trying to look for something that's new that we haven't really entered. Okay.
There's this whole state where people are question certainly comes up in many different varieties. In one situation, it's the national fiscal sponsor. So I guess the organization with the 501c3 is not located in the eligible state, but the community-based organization is. I'm not sure how to answer that one. Susan or Lynn, do you?
Can you read it again, Matt?
I'm sorry. It says the scenario is that the national fiscal sponsor is not located in one of the eligible states, but the community-based organization is. I guess they're saying the lead organization would be in the state, but the national fiscal sponsor with the 501c3 is not.
Does that, if that's meaning, is the fiscal sponsor located and registered in another state, but that's the fiscal sponsor for the community-based organization, but the community-based organization is actually located and works in one of the eligible states, then that's okay. Just be very clear if you decide to apply. Just clarify that in the proposal. There'll be places for that. A few questions about topics. Is this grant focused on youth population? Really, we hope that what's come through in the call for proposals is that this idea is to really focus on raising the issues that are important and that to the community and on which community partners want to work, and also with whom they want to work on impacting and communicating with state policymakers. So yes, if the community decided that that was what they wanted to work on, that related to youth, that's absolutely fine.
And I'll take another one. This is a good one. Is there a cap on how much we spend on evaluation/research? Some funders limit that to a percentage of the award. This CFP doesn't have any guidelines like that inside of it, but what you should do in your proposal is explain how your recommended allocation will go far to accomplish the overarching goal of the CFP.
Here's one. Can you talk more about the letter of support from any confirmed key partner organization? Can we include partners that are not yet fully confirmed? So I guess I'm envisioning this is about, like, you know, you've got organizations that you think will be on board, but they haven't had full approval from their board. I think we would be, as far as the application goes, I mean, I think that having the letter of support, at least from a lead person in that organization saying that we are interested in being part of this, I think that would, you know, that would be good to see. I don't, you know, certainly would be even better if there was final confirmation from the board that they want to do this. But I think that just knowing that there's a relationship there, that there's some committed people on the other side of the partnership would be, you know, I think you should go ahead and include those kinds of letters in your proposals. We're coming to the end here. Please do any last questions here.
Just as a pretty quick one, do you anticipate receiving more than one grant from a state? And if so, how will you handle that? There very well may be more than one grant application from a state, and the way that we would handle it is to assess both of them according to the eligibility and selection criteria.
One of the most recent questions here is there a preference of medical versus outreach? I'm not sure how to interpret that one. And if you all aren't either, then
perhaps the person who wrote that can send an email or go onto the site and ask it, and then we'll do our best to answer it.
Another person, here's another kind of potential topic area, disaster preparedness. Might disaster preparedness be considered health for purposes of this grant? I think, and again, Susan and Lynn, please weigh in, but I think that if you can kind of make the connection about how this subtopic of health is part of the larger picture of health, if this affects people's physical health, and I think the disaster preparedness does, then you can make the good case for that being a focus. But also keep in mind that I think, you know, what we want ultimately out of these projects is better engagement infrastructure, which enables people to tackle all kinds of things that they care about, you know, relating to health. So if you're trying to do something which is only ever going to be useful for one thing, preparedness or anything else, that's probably not as compelling as something that says, well, we're going to use this issue particularly at the beginning because we know people care about it, and for various other reasons we know we can get a good start on this particular sub-issue, but we anticipate building something that will be useful in all kinds of things. I mean, that's, I think, more the kind of thing that we're hoping to see.
And maybe this is a good follow-on question. Do you want us to define a goal around a solid policy win, or is success also defined as increased engagement? And you just talked about the strength of the engagement. Well, go ahead, Matt.
No, I guess I was just say that I think what we're hoping for is to create, help people create better infrastructure so that both can happen, and that those two things are related, that engagement is stronger, broader, more people, more informed, and that for that reason, it has more influence on policy. So being able to say, you know, we think that we're going to have an influence on a particular policy question, or a set of questions because we're going to do X, Y, and Z. I think that's the way I would put it in the proposal.
Absolutely. And Matt, because we're almost at time, do you want to go to the last slide and reiterate where people can go? Thank you. Yes,
good idea. So yes, please keep sending us questions by email or giving us a call. And keep checking out these two sites. So communityvoicesforhealth.org has all those resources that we listed for you earlier, and other things about the project itself. We will, I see a lot of support for a bulletin board, that's probably where that will be linked to. It'll be a link to a Google Doc. The way that would work, though, just to remind you, is we're setting up a space for you to populate. So we're going to say, are you looking for other partners for a Community Voices for Health application? If so, put your organization's name and your contact information in the right row according to the state you're in. So it's just going to be an empty chart that we will be relying on you to populate, and then you can find one another that way. So the resources will be at that site. The CFP, the webinar recording, the FAQs are also available or will be available at the rwjf.org/CFP/CVH site. And then here again is the email address and phone number you can use if you have further questions. Any final words from either of you, Susan or Lynn?
Great. First of all, I want to thank you, Matt and Lynn, and I really want to thank everybody who called in. We are really, really heartened by people's interest in this topic. We obviously think that it's very critical, and I am glad that so many of you are interested, and we look forward to reading your proposals, and thank you all.
Absolutely. Thank you, Susan. Thank you, everyone, for joining us today. Please keep in touch. Anything else, Lynn?
No, I echo what Susan and Matt said. We're
awesome.
excited.
All right. Thanks,
Great.
everybody.
Okay,
have a great afternoon.
Bye-bye.
Bye-bye.